Hi, I'm Han Brown, the host of the Boomer Living broadcast. As the baby boomer generation ages, they are facing a variety of unique challenges, including senior healthcare, dementia, Parkinson's, caregiving, technology adoption, affordable senior living options, and financial insecurity, all of which can be very difficult to navigate alone. The Boomer Living broadcast is here to help. We provide accurate and up to date information on all of these topics so that the baby boomers and their loved ones can make informed decisions about their future. We also offer a wide range of resources and support to help the baby boomers and their families through every stage of their journey. So we believe that aging should be celebrated, not dreaded. Please check out our newly launched platform, Senior Care System, an all in one sales and marketing platform for individuals and businesses that provide care for the aging population. Senior Care System, one app to replace them all. Thank you so much for joining, and we're excited that you're here. We want to encourage that you ask questions, chime in, and let us know what's on your mind, and we'll do our best to answer them because together we can learn a lot from each other. So today's topic is how health technology is helping older adults face aging, disease, and disability. As the baby boomer generation continues to age, there is an increased demand for technology enabled services that can support healthy, independent aging. From remote patient monitoring and on demand home care to assisted technologies and social networks, these tech enabled solutions are helping seniors to live fuller, more engaged lives. Besides the direct to consumer solutions, there's also a growing focus on using technology to enable multidisciplinary approaches to promote healthy aging. These techniques and interventions combine mental exercises, nutrition, physical exercise, and social interaction to create a holistic approach to aging well. And by utilizing devices like virtual reality headsets, robotics, cloud enabled fall detection watches, and other health technologies, we are able to create a safer, more connected environment that is better prepared to meet the needs of our aging population. So today, my guest is Dr. Tazeen Rizvi. Dr. Tazeen is a healthcare technology leader, clinician, digitization expert with over 15 years of experience designing and developing data driven systems. She holds a master's in healthcare management from Royal College of Surgeons. Recently, she ventured into emerging technologies after completing a degree in University of Oxford in blockchain strategy, cryptocurrency, and NFT. Dr. Tazeen is passionate about using technology to improve patient care and expand market growth. So, Dr. Tazeen, welcome to the show.
Thank you very much, Han. Thank you so much for inviting me to this discussion. And I must say that you guys are doing such excellent work. And
Thank
as you
you.
said, that we have to have more people talk about it. It's a collaborative effort, and I am glad that I can be a part of it. Thank you for the kind introduction. I will start with a little introduction about myself. I'm a clinician, but I've been doing designing digital technology for the last 15 years. And what I do and how I fit into this space is that I bring a clinician's perspective and a patient's point of view on how these technologies should shape the way we deliver care today. Because it's very important, and I'm a great advocate that care teams, carers, clinicians, pharmacists, and everybody, every key driver along the care continuum has a role to play, and they should be part of the process of digitization. And obviously, it has to be patient centered. So that's where I come, and I am working in this space to develop better solutions and use technology as an enabler to promote healthy living and healthy aging as well.
Mm-hmm. Well, thank you. Thank you so much for your work. We're very blessed to have you in the industry.
Thank you.
Yeah. So, technology. Thanks to the technology, we pretty much can do almost anything from our home, from groceries to healthcare and to socializing, which is very good for seniors who have trouble getting around. Tech-enabled services can help seniors stay connected to the things that they need and enjoy without leaving their home. So, what are your thoughts on tech-enabled services and social networks that support aging?
Okay, so I think technology has creeped into every aspect of our life. As you said, we shop online, we book our tickets online, we plan our holidays online, we do banking online. And I know pre-COVID, healthcare was just standing at this brink where we knew technology could help, but we were just a bit scared to take the leap. But I guess COVID propelled us and created an environment for everybody in the world at the same time, which only a pandemic can do, to realize that technology can actually improve access to care. Because it had to be a mind shift. It had to be a situation where we knew we can't go into a hospital to see a doctor. We knew we couldn't sit in a waiting room area to see our GP. And this was replaced by telemedicine and virtual care. So technology was used in the past 3 years, and now thankfully we're over COVID. But in the post-COVID world, the last 3 years have taught us that technology is actually a great enabler and is
Mhm.
actually providing opportunities and avenues for us to improve care, not only for the aging population, which again is a big concern because of the number of people that are in the world that are reaching 70 and 65 plus, but across the entire population. So, as I always say, Han, and technology is an enabler, is a tool, right? And it has to be used within a system. I mean, it
Mhm.
has to be used with the clinicians, with the care teams, with the nurses, with the carers, and should focus on the patients, of course. So, when we talk about how is technology helping the older population or the aging population, so I usually always answer this question whenever health technology is asked, that there are two main areas where technology can really help. One is prevention, and the other is management. So I see when we talk about the aging population, and on the last data that I think read online was that there'll be a sharp increase in the number of people over the age of 70 from 12 to 22% till the age till the year 2050, which is a stark increase, and which really does show us that we need to really focus on preventing certain diseases before they become dis- before they disable the person, before they
Mhm.
go to a point of no return. So my
Mhm.
belief is that the one thing technology can really, really help the existing clinical system is preventive models. Now, how does, and I think that's where we are focusing on, and that's where the bulk of the focus should be, because then you prevent the person from disability, in decreasing the burden of disease of the overall population, and also helps, and also helps the loved ones who are taking care of a person. I think we were just discussing a few minutes before we went live that all of us, I think, have a loved one that we're caring for. All of us have somebody that is in that bracket of age where they have physical frailty, they have cognitive decline, and we can see that. So, how is technology helping? So, as we all know, there is a healthy aging and there's pathological aging. Healthy aging
Mhm.
means the natural process of aging, where of course you're not going to be as active as you were in your 40s, obviously not as vibrant as you were in your 50s, but a general decline is a physical strength and a general and normal aging of your cognitive abilities. But then there is pathological aging, where these are underlying conditions like dementia, Parkinson's, and other chronic illnesses like hypertension, diabetes, and other, which really add on to the burden of aging. And that's where we see a more rapid decline in physical and cognitive frailty, as we say. So, technology is a great tool for monitoring population before they reach the point where they become a burden. So when we talk about remote, you mentioned remote patient monitoring and virtual telemedicine. Now, technology can be used. Now, as you grow older, it's difficult for people to go out and do their
Mhm.
groceries. go out to meet their friends, go out to see the doctor. Now, technology offers you these platforms, from mobile applications to web cloud based application, where you don't really need to step out to see a doctor. You can see a doctor on your computer, on your phone. I think that's a way where you can actually empower patients to become more compliant. Like when you know, oh, I don't really have to step out, take a bus, or call my daughter so she can take me, or my son to take me for my appointments. I can see it from the comfort of my home, and I'm more likely to take that
Hmm.
appointment. So that's where I think adherence to or seeing your doctor kind of becomes easier, more accessible, uh, for the older population with the advent of this virtual care platforms, which we call telemedicine. We have numerous mobile applications. We have web-based applications. You can take take a consultation on your iPad or any device on a big screen as well. So that's a great help. Now, and once you have seen a doctor, when you know that you can talk to a specialist without, waiting in line for an hour, getting exposed to other infections, you're more likely to keep that appointment. And then once you are you have a chronic illness, or you get diagnosed with, let's say, a common cold or a common illness, you obviously get a prescription. Now, as human nature, I mean, research has shown that we are more compliant towards taking our medications after we see a specialist. And
Hmm.
as the time goes by, as that reminder fades off, we become less and less compliant. Now, this is what we're talking about people our age, right? I definitely would say that about myself, that if I see a doctor, I will remember their words for like a week, 10 days. And then I'm going to say, oh, it's okay if I miss a pill. Oh, it's okay if I miss 2 days in a row.
Right. Because we see positive results as if that's enough, and then we stop doing what we're supposed to.
Once we start getting better, it's a
Hmm.
human nature that a lot of people
Right.
say, you know what? I don't think I need this every day. Yeah,
Hmm.
because there's nobody telling us that you need to take this every day. So again, combined to virtual care, we're talking about these medicine alerts and reminders. I think these are really good, especially for people who have a cognitive decline, who just have memory loss, but just as a positive reinforcement that did you take your medicine today, and are you taking your medicine? And now technology has already advanced to the point where if you have a patient who's supposed to take certain medications every day and they miss a couple, they can send out a reminder to their next of kin, or their carer, or their nurse if they're in a managed care setting, that the person has not gone on the app or has not taken the medications. That, again, medicine adherence is a big part of prevention. It's a big part of not not taking patients to the point where, oh, they need to be hospitalized. Now they need to be in a nursing managed care, because I think that's where technology is really augmenting our existing systems, because our existing systems of healthcare delivery are overwhelmed. We saw that
Hmm.
in COVID. We have an acute shortage of healthcare professionals, nurses across the care continuum. And if we somehow use technology in the right place, that we are preventing people to reach them, and we have significant um, areas before they go to a point where they have to be hospitalized, I think that's where technology can bring the most value to the current system. So you've got virtual care, you've got medicine adherence platforms, which now are, I mean, there are plenty of apps out there which can give you alerts on your phone. Those alerts can come on your devices. Those alerts can
Hmm.
come on your TV. I mean, your TV, you can program your TV to tell you, oh, did you take your medicine in the morning? You've got these alarms fit into robots. So that's, I think, one way of making sure that people are preventing further deterioration of a condition when it's diagnosed. And then we have these really amazing tools specifically designed for the aging population, as we call them, drone technology. Now, these are technologies and platforms which are specifically designed for helping the aging population to help them age in a healthy way, and to prevent further disability or further deterioration of the condition if they have one. And I think these are, and we also talk about a term quite frequently now, is aging in place.
Hmm.
Again, there's a phenomena, and I think, yeah, I'm sure you will resonate with a lot of people, that a lot of older people want to live on their own.
Hmm.
Because when you tell them, oh, you need to come and live with us, or you need to go into a care facility, their sense of identity or independence is
Hmm.
taken away. And
Yeah.
when you're in a position where you already, you're not financially independent, you're not in a workforce, if you feel that, oh, now I can't even live alone by myself, it just gives you that, it further, I mean, I think, has an effect on your mental health. And
Absolutely. Yeah.
I,
Because you're already losing so much, right? Perhaps it's your mobility, your cognition, and now your home
yeah,
that you lived in 30, 40 plus years. Those are significant. I mean, I'll have to say it loss or decline. So that is going to have a huge impact on your mental health. And to your point, as far as technology to help the day to day living. I mean, we all experience this. Let's say at any age, for instance, like Skype and FaceTime, for people that want to get some tasks, household tasks, help. There's like Task Rabbit that can come and help you with that. And like
that's
you mentioned, you can order groceries from Amazon Fresh or Walmart grocery pickup. You could also join local seniors group or clubs to make
true.
new friends. That certainly will help with the isolation. And you can find a trusted caregiver through online sources like care.com. There's tracking devices, there's
Tracking device.
ride sharing services, Uber, Lyft, and you can also even make a little extra money, rent out your space through Airbnb or VRBO,
True.
right? You could
Yeah.
order food through Grubhub. I'm just
Yeah.
kind of
Yeah.
downloading a
So
list of
that's
things.
exactly. So, aging in place is something that is getting promoted now. And technology in that particular space is great. I mean, from my personal experience, and I mean, I have my father in law is 80, and he
Mm,
absolutely refuses to stay with any one of us. I mean, he's healthy, but obviously he has that normal aging, cognitive decline, physical frailty, but he's all right. And he says, you know what? I don't really need you guys
mm,
at this point. So what do we do? And I see so many of people in my age group going through this. And even if you're not living alone, I would say, when you have a older person living with you, you
mhm,
go to out to work, they can't go on holidays with you, so you can't monitor them 24/7. And I think that's where we've seen an amazing innovation, or where people have developed amazing technologies to help a people of older age live safely in their homes, apart from ordering food, ordering groceries. Now we have these motion detection sensors. Now,
mhm,
speaking from my experience, like my father-in-law, I mean, he lives alone, but his entire house is fixed with motion detection
mm,
cameras. Now, what we do is we just want to know that you're all right. He got out of bed and had went to the bathroom, had his meal. We know that he prays this time from this time. So it's just an assurance that he's all right. Now,
mhm,
these tools are really amazing for people who are living alone, and they range from these passive technologies. Passive meaning they're not intrusive. Passive,
mhm,
you could have motion detection, these lights, motion detection, that they can sense if you're moving around. If you're not moving, they can sense that nobody was moving. But we have also active sensors now that you can wear as a bracelet that
mhm,
give real-time information that, oh, this person moved this much. Or we also have these weight sensors in bed, again, which track how much you're moving in the bed, how many times you went to the bathroom
like
during
patterns
the
of
night,
behavior.
patterns of behavior. Exactly. So that's where I think technology, even passively, non-intrusively, has come a long way in providing a safe environment for people who are physically frail or who are vulnerable to fall, to forgetting things, which which I think is great and really does help aging in place, that they are in their place, they feel independent, but we as their loved ones know that they're okay. And God
Mhm.
forbid something happen, we know that we will know in time.
Mhm.
So, and again, collecting patterns. I know in med school, we were always told, you'll never know the abnormal if you don't know the normal,
Mhm.
right? So
Yeah.
how
Yeah.
do you measure the normal? And if we don't have a baseline, then we don't know if something is going up and down. And that's where these data driven technologies come. If you're tracking somebody's mobility, let's say over a period of time, we kind of have an idea about their patterns in a day. And if you, let's say, have somebody who lives alone, and these sensors give you an idea of how much they moved. Let's say you see 2 days they didn't come out of bed. Oh, 2 days they didn't make breakfast. Oh, they had breakfast in bed, they didn't sit on the table. And
Mhm.
these are early signs of this something's wrong. Because another thing that obviously we all feel, when you have a cognitive decline, there's a decline in communication.
Mhm.
A lot of people are not able to express that they need help and may not even want to say out loud. And that's where we say the soft skills of how to manage a person who's aging. Now, but and you're not living with them, so you can't really say, oh, they were grumpy in the morning, or they weren't looking themselves. Now, technology is telling you a change in pattern in the behavior is a great
Mhm.
indicator of person's physical and mental well-being. Now, if you can see if somebody has these sensors, you can see, oh, they haven't moved much in the last 2 days. They
Mhm.
didn't really go out for their walk. And you know what? They didn't sit on the table to eat, they didn't pray. And that's an early indication. They haven't told you they're not feeling well, but you know that something's not right. So if you're caring for them, you can ask a carer to go and just have a conversation with them, or you as a loved one could go and pay them a visit. So these are the kind of things that really give an idea. And these early detection that a person may be getting a bit depressed, may not be feeling really okay, are great into preventing that decline that you would see if you had no idea the patterns of behavior have changed.
Mhm.
And this is where I think technology can really augment where exactly the intervention is required, on when exactly is intervention required. So, I mean, these are really smart. I'm not going to name the companies because there's so many, but these are really smart, really nice looking lamps now, which are
Yes.
motion detection. Now, and they're so smart that they will detect motion and they will
Mhm.
track your moves. And they, once you go to, they will open the light when you go to the bathroom, they'll close the light, they'll set your room temperature
Mm.
according to the weather outside. So these are kind of things that really actually assist a person who's living independently. And they
Mhm.
really do give a sense of, I think, peace or sense of comfort to the loved ones, that, I know they want to be independent, but I know that I know what they're doing. Um, they're okay. They're out and about, and then they're doing their activities. And we talk about, and I think one of the things that we talked about initially was fall. Like, I mean, physical frailty with cognitive decline, visual impairments. I mean, that's one of the areas that we're always scared of, a person living independently who might be physically flared, that they can have a fall. And I think, again, that's an area where technology has been able to make great advances in terms of, again, in passive recording of behavior and active recording of behavior. Again, passive, we have sensors, mobility sensors right now that actually can measure your gait, your posture, your mobility around the house if it has changed. It's an early indication to the care teams that something has changed. Again, then we have active, if somebody is really frail or maybe had a fall before, but so to prevent further falling, there are these tracking belts
Mm.
which
Mhm.
which are instant alerts. So you wear a belt. I mean, they're active trackers, they're not passive. And once they keep on giving real life data that, oh, the posture is off a bit, and if they fell, even if they not even fall completely, even if they don't hurt themselves, if you fall and they record it, it's an indication to the care teams that this happened,
Mhm.
that there's this
Yeah.
further decline in their posture. So these are the interventions that actually prevent from further disability. And I think that's where technology can really make a difference is in prevention. Before a disability becomes to the point where they have to be taken away from their homes into a care home, or a carer has to live with them. Because we all know, with the overwhelmed care delivery model, we have shortage of people. So
Mm-hmm.
these tools are really good at augmenting the existing care teams, maybe assisting the shortage of resources that we see. Um, and I mean, I can go on. I mean, they're now, when you talk about social media and communications, they have, now we have robots.
Mm-hmm.
Although I don't know how I feel about them, but I mean, they are AI enabled robots where they can actually have a conversation. And then we have Amazon has Alexa, we have Google, where you can actually, ask them, what's the weather like today? And could you, again, order groceries for me? These are great aids to actually assist people or help them to age in place.
Mm-hmm. Yeah. I mean, you know, there's a lot of innovations around robots, and I think it has a time and place, right? Um, I have my reservations, but I also see some potential. Um, to your point about prevention, I've always thought prevention is cheaper than cure. Prevention could
Absolutely.
save lives. So anything that we could be in that mode of prevention, proactive, to support that independence and healthy aging, that will defer or postpone you from assisted living, let's say. So,
Absolutely. Yeah.
yeah.
And I mean, we know some things are inevitable. As I say, there's a
Hmm.
healthy aging process and there's a pathological. There is a
Hmm.
normal cognitive decline and there's a pathological cognitive decline.
Hmm.
Some things are inevitable, but prevention can actually ease them into this, in this process, which is natural. As you said, aging should be celebrated and not be afraid of. I mean,
Hmm.
if we know that there are, technology can assist us into taking care of our loved ones in a more managed or in a more monitored way, that does give us some comfort as well, and to the people as well, that now, as we talk about cognitive decline or diseases like dementia and Parkinsonism, and you talk about prevention, I think just the other day I read a study about professors from MIT that said that, from the nocturnal breathing patterns, they can pick up early cases of Parkinson's. Now, these are the interventions and these are the uh, technologies that will make a difference in preventing early detection, early diagnosis, better treatments, better prognosis. And that's where we can actually say that we as a society are moving towards a proactive, a preventive care delivery models, assisted with technology. I might add that technology also, Han, does not have all the answers.
Yeah.
It is an enabler, it's a tool, but it can't work in silos. It cannot do the job on its own, because see, all these alerts, whenever you talk about, oh, this sensor fall detection belt, what do when something happens? They call a human being, they call a care
Hmm.
team, they call an ambulance. So
Hmm.
in the end, we need to, as I said, in this entire ecosystem, technology is one part.
Hmm.
It does not replace all the other pieces. It will not replace you for your parents. It will not
It's
replace.
an
It's
instrument
an
that
instrument,
can that
and
can.
that can really improve. But and
Mhm.
when it's given in a way where it's all the stakeholders are on the same page, it really does improve the quality of life of people,
Mhm.
and it does really promote the proactive and preventive care delivery models.
Absolutely. Thank you. Thank you so much for that. I often think, I know there's apps out there that could determine, predict, or give you some kind of indication whether or not you might be at risk for dementia and so forth, which is great. Okay. And then I ask myself, so let's say I take one of those tests and I am one of those people that show that I'm at risk. I mean, why not? My mom, my in laws, what would I do differently? And I tell myself, I'm going to live every day as if I'm going to have something. I mean, does that make sense? In other words, you have to be proactive in your own health,
Absolutely.
outside of your doctor's office, because that's only once a year, right? For what, 10
Yeah,
minutes or
yeah.
so? So I take on the attitude where health is everyday choices that I make. Sure, I can use an app, but I don't really care to use an app to determine if I'm going to be at risk because I'm going to live every day as if I am at risk, right? I think we're all are at risk.
I think we're all at risk, and we can't really predict, as I told you, that we can't really predict the course our aging will take. As you
Right.
we were talking about before we went live, we can't predict. None of us can. Yes, genetics plays an important part. Now we are doing genome studies to know the effect of certain people have certain genes that make them more predisposed to certain conditions. But that does not say that if I am not on that, let's say, spectrum, I won't
Right.
get it. No,
Right.
we still don't know. And absolutely, Han, healthcare is just one part. And I think especially with these diseases like dementia, cognitive decline, we know now that there is healthy living does affect environmental factors do affect your entire health, what you eat, what you do, how much you exercise, how much you I mean you exercise your brain, not just physical activity. These all combined together actually make you one person. It's everything. It's your social interaction, it's your especially diet. Now we say that diet is also big part of how we are going to behave. And so I absolutely, I mean, we need to take an active part in our health. And that's where, again, I would go back to technology that remote patient monitoring has done to us. It has given us a tool where we know if something abnormal happens. Like I would say, not only the aging population, I think almost everybody I know wears an Apple Watch, right? A lot of people who didn't know before now know how well they sleep at night. Are they getting REM? So non-clinics, non-medics in my friend circle, they actually would text me. So what is the rapid eye movement sleep? And I just got this much sleep, So, it's good that we now understand that eating, exercise, sleep is such an integral part of our entire holistic health and our mental well-being. It's good. I mean, it's good that we have to take active part in our health. It's very important.
Absolutely. Yeah, I wanted to acknowledge our guests. Thank you so
Yes.
much for joining, Musa, Rafael, and Dr. Maida. Thank you so much for joining. You folks are really asking some good questions, and then we'll go through and answer them. And thank you so much for Elsa. And hey, Ravi, how are you? And also Barbara. Thank you so much for being here and asking some questions. All right, so let's address Ravi's question. Is there a biomarker library that lists the various biomarkers by disease? In other words, nocturnal breathing for early stage of Parkinson's and gait variation for potential UTI. You care to
So
take that
that is
on?
a very good question, Ravi. I wouldn't have access to a biomarker library right now, but I can definitely, send you this information afterwards, because there are so many that we're tracking now when it comes to studies of how biomarkers are predicting. So it's definitely an area that's getting a lot of focus, and I will share that information with you after our recording.
Sure, absolutely. And thank you, Barbara, for sharing something about the phototherapy. Okay, yep, thank you so much.
Phototherapy.
And let me see here. I just want to acknowledge a couple. Hey, Maria, thank you so much. Grazie. All right. So I'm going to move forward. Let's talk about the point of view from a consumer, the baby boomers, the older adults. Change is very hard.
True.
We get comfortable with the status quo, and it can be tough to break out of our routines, especially as we get older.
Absolutely.
And when it comes to technology, this is doubly true. Some seniors may be reluctant to use technology or tech-enabled services and social networks despite their ease and connection and security. So I think the biggest challenge facing seniors when it comes to using technology may not be the technology itself. It could be the willingness to embrace change. So what do you think, I suppose? I mean, what is the most difficult challenge for seniors when it comes to adapting technology?
Yeah, that's a very valid point, adoption. And it's not only, Han, I wouldn't say it's only for the like the aging population. We see that a lot all the time. Why aren't more and more people adopting technology? And this is a barrier, but obviously communication is one thing that is so important. Messaging is so important. And when it comes to uh, the aging population, what we really need to understand, especially the technology companies out there and people who are actively producing technology for this Giron technology, what they need to understand is that this population didn't grow up with an iPhone.
Hmm.
So I don't really, my instinct is not to pick up a phone and call somebody. My instinct is not to go on Facebook and ask a question. That has to be trained. And that has to be, it has to be more informational. Because I believe that if you really talk to people and give them the benefit of what this can do, they really aren't that averse to using it. Because I've been reading a lot of studies and even from personal experiences. When I talk about passive and active, so these passive technologies which don't really intrude but are there, and even these groups that you said, social networking groups, and you can introduce them slowly. But I think
Hmm.
messaging is very important. You really need to tell them that this is for your benefit. And I think it goes two ways. I don't think they're really averse. I think if they're really brought in and the technology is designed to what they really want out of a solution, that I think they wouldn't be averse to using it. Because in the end, see, everybody wants to be healthy. Everybody
Hmm.
wants to feel good. Everybody wants to get out of bed in the morning and being able to walk. Everybody wants to see their grandchildren. So, it's just that how we present technology to them, and how these apps are user friendly. Again, how are they designed? Are they designed keeping in mind that this might be used by somebody who doesn't know these jargons, technology jargons, who doesn't understand language that we use on social platforms? So it's very important. So for adoption, I think it's how you message, how you package the message, the social interaction, how you sell it, how you design it, and how you personalize them to that they feel that this is what they need, and this is what they want, and this is what will help them. Is again, it really does in the end go down to how we present it to them. And I
Hmm.
think Dr. Maida did raise a point here. I'm just going that people aren't that. It's a misconception that boomers are tech averse, that they might be open to new technologies. Again, it's so important how it's presented to them.
Hmm. Absolutely. And I think it's, I don't know if there's an absolute answer because there's the use, there's the support, there's the education side. I hear you. I am wholeheartedly a believer in that. And, I'm trying to put myself in a consumer, in my sister who's 75 years old. She uses technology, but not regularly. So she'll remember this month. Later, she used it a couple months later, she'll forget, and then she may not have anybody to support her, and then she wonders, like, the people that claiming to be helpful, are they really who they say they are? And then, of course, when people use too much technology, let's say Facebook, for instance, or any social network, does that make them feel more isolated from the people around them? And of course, the support is key, right? Even you
Absolutely.
and I mean, I need support with my
Absolutely.
third party app that we're streaming right now occasionally.
Yeah, yeah.
Um, and then the trust that the information that you're getting from that service, is it safe and secure online? And are these people qualified and trustworthy with these services that I'm using, right? Um, and let's say I stop using this tool. What happens to my data? You got my phone number, you got my
Absolutely.
address,
Yeah.
and you got my credit card.
Yeah.
And then, of course, how much does this cost? I mean, some are free, but how much does this technology cost in terms of money and time, which can be very important in terms of for the seniors because some of them are on fixed income. So those are kind
Absolutely.
of things that run through my mind because I see it in my older siblings. So technology, absolutely, we need it. It promotes healthy aging, but then there's the support, the infrastructure,
Absolutely.
the education, and the assurance that you're in good hands. That's a different topic, right?
Oh yeah, again, coming back to the same point, technology is a solution that
Mhm.
in silos can do nothing, right? It has to have this support of people, infrastructure, safe. When you talk about safety, when you talked about cyber, are this information safe? Uh, it cannot replace human interaction. A, social
Mhm.
media cannot. B, we can't say that, oh, they have an iPad, they have these sensors, really cool sensors, a robot, and all the gizmos. Oh, they don't need me to see them. No, that's not
Mhm.
true.
No.
Again, technology is an enabler. You have to use technology to benefit you, to get value driven information. But it's so important to make them understand, again, the trust, make them part of this. So I talk a lot about, when we talk about data, absolutely. We talk a lot about data, getting data, data of how they're sleeping, eating, moving. Where is that data going? Who owns this data? Is anybody
Right.
taking consent from them? That we are
Mhm.
continuously monitoring your everyday activity. That is where it's so important. Consent is so important.
Right.
So
Who gave
every
permission?
who
You're
gave
right. Was it
permission?
the loved one or is it the
And is it
senior themselves?
informed consent? I absolutely
Right.
think people who are aging, don't necessarily, we can't say, oh, they won't understand what it's doing. No, they will.
Yeah.
Give them information, take an informed consent, tell them that it's their data, tell them that we're extracting meaningful information for better treatment or personalized care plans. We we have to make them part of the journey. Again, it has to be, they have to feel that they're part of it.
Right.
I wouldn't, even I wouldn't trust somebody that's withholding information from me. I'm going to
Right.
say, oh,
Right.
they told me this is good, but can I trust it? When do we build trust? When we are extremely transparent with them.
Mhm.
And that's where informed consent, take their consent.
Yep.
If you
Yep.
think if there's a cognitive decline or there's a disability where somebody can't give informed consent, then it's a different thing. But if you have people who are living alone and there's these monitors and these bracelets they're wearing, they have to give consent. They have to know this is their data.
Right.
And this is where I think, where the work needs to be done. We have so many data driven technologies, data driven social media platforms, but where are these guidelines? Who is this data?
Yeah. There's the
Who can
ethics
have
side of it.
access to data?
Mhm.
And that's why I say social media is great, but it may not
Yeah.
be great for people who are vulnerable.
Right, right.
Yeah.
We have well, we got about 10 minutes and we still have a couple questions. And I want to acknowledge John Caspero. Thank you so much for asking. Okay, so do you see his question, Dr. Nazim? Can you acknowledge that? You provide a thorough
What role
overview
plays
of
this
tech that
technology in
helps age
helping the
in place?
population manage project conditions? So I think we did, I did talk about the role of technology in prevention of healthy aging, no, monitoring of healthy aging and prevention of chronic conditions and disability. And I think, thank you, John, for the question and for joining. I think technology can really help us do data driven technology, do predictive analysis, make use of data to make informed decision about the treatment plans, remote patient monitoring to see if there's an abnormality, AI driven platforms to tell us, give us more personalized treatment plans. So I think chronic care is something that technology can really help us manage better.
Yep, I'm going to acknowledge Ravi. Thank you so much, Ravi, for asking. Technology done well will enable us humans to do more of what only humans can do.
Absolutely,
Absolutely.
absolutely, Ravi. You really
Thank you.
said it right. It just makes us make better decisions.
Yeah.
And I talk a lot about AI, and I say, you know what, AI is as good as the data you feed it. It has to.
Hmm.
You're feeding the data, so we can't say, oh, the artificial brain can do everything. No, it's we are the ones who are feeding it. So
Absolutely. So we got a couple questions. I think we got about 5 minutes. LinkedIn likes to end the conversation around 50, 55 minutes, even though I set it for an hour. Okay, so how can families ensure the safety of their loved ones when using technology and social media? I know we touched on this, but I think this topic deserves, time for itself.
Right.
So what do you think?
Absolutely. It's a great way to finish, Han. So I think absolutely, like we talk a lot about how, oh, our children, are they safe using these apps? I think the same goes to our aging population. Again, as I said earlier, they weren't trained in a digital era. So, even for me, I would say my kids know more about the perils and dangers of being online than I do. Because after I became an adult, I started using the phone. And you're talking about people who were never exposed to this technology. So it's very, very important that we talk about, again, make this a conversation with them. Safety is using social networks, safety of using these devices. So, again, I would come back to, there are a lot of really good apps out there that you can install. Let's say you have a loved one that is using an iPad and you talk to them on the iPad, their devices are connected to the iPad. You can install softwares that actually protect your ID, protect any information that is being stored, and gives you alert if they see abnormal activity. So this is very important. Again, educate your loved ones on having password password protection, right? Everything
Privacy
have
settings.
privacy settings, password protections. I would say, once in a while, go in and change their passwords. Obviously, tell them, but change their passwords. Put 2FA, two-factor authentication, which ensures that these are the people who are accessing a certain app. Because we need to understand, if I can talk to my father on FaceTime, so can anybody else in the world,
Right.
right? If I can message my loved one on Facebook, so can everybody else in the world. And we know that there are people that can make use of the information that is out there, and in fact can even maybe lure these aging people who want to talk to somebody into disclosing certain information about themselves, which they should not be doing. And that is why it's so important. Have these conversations with your loved ones. Have these
Yeah.
conversations. When you give technology to someone, you have to tell them how to use it, what to
Absolutely.
say, what not to say. Don't share your passwords. Have 2FA, change your passwords. Have these protection softwares on your devices that can track. Absolutely, this is very important.
Yeah, no, it's true. I mean, anything that I would instill in my younger kids, well, they're adult now. Let's say they're 25, 20, and 22, but let's say when they were elementary age, it's the same thing that I would share to take extra precautions for my mom, let's say. Block unwanted calls and messages. Take a screenshot of certain conversation that you see to be fishy. So
Absolutely.
those are all steps that you can help your loved one to stay safe. Now,
I have a question
we
from
got
Elsa.
one last question.
Yeah.
Okay. Well, we have two, but I'm going to just go to one because we're at the tail end right now. So, what are your thoughts on the future of age tech?
Okay. So, I'm going to answer Elsa's question as well. I want the future tech to be affordable.
Hmm.
Elsa, I don't think it's affordable. We say it's great and it's absolutely great, but when we talk about digital technology, we're actually really talking about some percentage of the world population. Not everybody has a smartphone. Not
Hmm.
everybody has access to internet. I think from the last study I read, there are 3 billion plus people who don't have access to internet, and all of this technology is dependent on smart devices, which
Hmm.
are extremely expensive, and a 4G internet at best, which isn't available everywhere. So, what I would really want to see, Han, is technology to become affordable,
Hmm.
that we are able to offer these solutions to all segments of the population and not
Hmm.
just fix on one segment that can afford it. So, absolutely, we need to work on making the technology more affordable. And what I want technology to do in the future is that we need more collaboration. So I see some great apps out there. Every day I would say I'll get a message on LinkedIn and somebody would say, you know what, I've developed this great app. That's great. It's amazing. And I can see this will continue as we evolve. Technology is changing. Are we really we're not really integrating it into a system where all of these people are sharing information, putting patients at the center. So, Han, I would want to see technology to become more integrated, technology to promote more integrated care delivery models, where the information trickles down and we are a patient centered care models where this information augments the um, physical, mental, emotional, lifestyle, environmental aspects of a person's life and makes informed and value based decisions.
Absolutely. More affordable, available in rural areas,
Absolutely.
available in multiple languages, and enable
And
audible,
available to
tactile.
both genders, I would say. I would like to say this. Yeah.
Yes, yes, absolutely. Well, thank you so much. I appreciate
Thank
your
you,
time,
Han.
your
Thank you.
expertise, and your passion in making it a difference in this industry. Um, do you have anything else to say before
No,
I
thank you
conclude?
so much, Han, and to everybody who joined the call today. I really appreciate it.
Yes, I want to acknowledge our guests here. Thank you so much to Musa, to Rafael, and Dr. Maida, Elsa, Ravi, Barbara, Maria. Um, Again, thank you so much for participating. We learned a lot from you as well. Well, in conclusion, clearly, we are on the cusp of a health technology revolution that will help us meet the challenges posed by aging, disease, and disability. The future looks bright for older adults and their families as we move towards more sophisticated ways of providing care and support. So, what do you think about these developments in health technology? Are there other areas where you would like to see more innovation? Let us know in the comment, and perhaps we can use it as a future topic. So, upcoming events. This week on Thursday, we're going to have Christopher Cunning, 11 o'clock on Thursday. Keep up with this topic. Get ready to experience the future of aging with Christopher Cunning, Thursday at 11. Topic number 2 is blockchain healthcare revolutionizing health data and its impact on the baby boomers. Topic 3, we're going to have research in age related cognitive decline and connecting the world of neuroscience and neurology and psychiatry. Topic 4, we can help you breathe new life into your multifamily and senior living assets. And topic 5, aging in place safely and successfully while preparing for long-term care. And also, the last topic, or at least for this coming month, reframing the perception and experience of growing older. If you would like to stay informed, up to date with upcoming events, please comment in the below, subscribe so that I will add you on the distribution. Thank you so much, Dr. Tazeen,
Thank you
and we'll
very
see
much.
you
My
again.
pleasure.
Take care.